I wanted to start with the land acknowledgement. We are gathered today on the treaty territory of the Mississaugas of the Credit First Nation and ancestral and traditional lands of the Anishinaabe, Haudenosaunee, Ojibwe, Chippewa, and Huron-Wendat nations. Today, it is still home to many Indigenous people from across Turtle Island, and we are very grateful to have the opportunity to work in the community on this territory. It is our collective responsibility to pay respect and recognize this land as traditional territory. Next slide. December 6th is an important day. December 6th is the National Day of Remembrance and Action on Violence Against Women. I remember this very December 6th. Today, Canadians wear white ribbons to honor the 14 women murdered during the Montreal Massacre. We will never forget, and we reaffirm our commitment to end gender-based violence in Canada as well as abroad. I just wanted us to take some moments to reflect on this before we move forward in our presentation. Next slide. So tonight, I've already started my introductions, and we're going to move towards hearing from each of our panelists. We are lucky and fortunate today to have two physicians from the Department of Family and Community Medicine at Sunnybrook, as well as one of our neonatal intensive care unit pharmacists who works together with us at Sunnybrook Health Science Center. So we're going to start with short, snappy presentations from all three of our panelists. We're going to move at the end to question and answers, and then we'll finish up with a summary, and there will be a resource sheet that we're going to share with you in the chat, as well as on our slides. So a few housekeeping items. Since we can't see your faces over the camera and you can just see ours, we would love you to put your questions and answers that we will take at the end of the presentation in the Q&A area versus the chat area. We have two people who are going to be moderating the question and answers later, Nazia Hayter, as well as Kitty Pang, who are on the call as well. Next slide.
So I'm just going to briefly introduce Dr. Karen Fleming, who is the moderator for this webinar. So Dr. Karen Fleming is an assistant professor with the Department of Family and Community Medicine at the University of Toronto and at Sunnybrook. She's the chief of our department, so she's running this whole show, and her portfolio includes education scholarship, as well as being the director of mentorship and continuing professional development for the Division of Family Medicine Obstetrics at Sunnybrook. So Dr. Fleming has done a lot of great things for our community, including establishing the Women and Babies 4P maternal health clinic, and this clinic provides help for complicated pregnancies. So I'm now going to pass it off to Dr. Fleming.
Thank you, Nazia, for your kind words. Next slide. So our first panelist is Dr. Ali Appleton. So Dr. Appleton actually started her career at Women's College Hospital, where I was a faculty at that time. Since that time, Dr. Appleton has practiced rural family medicine, working in the emergency department, providing inpatient care, working in a long-term care home, as well as in the clinic for over 10 years. She served as the site chief of the Lions Head Hospital and lead physician of the Peninsula Family Health Team. She currently serves as the faculty development rep for the University of Toronto Resident Teaching Practices Program and does very regular virtual urgent care and spends some time with her own triple threat managing her 3 young children. So without further ado, I'm going to hand it over to Dr. Appleton to share all aspects of triple threats. Take it away.
Thanks, Karen. So I'm Ali, and as you know, I'm a family physician who's done years of rural clinic and emergency work. and recently lots of virtual urgent care work. I'm used to wearing many hats, but today I'm hoping to bring the perspective of what has been my most challenging job this fall, parenting and doctoring what I have coincidentally referred to as the triple threat in my home, my 3 young sons. As parents, we expect to see our kids get sick with coughs and colds. We don't like it, but we know it's a regular part of caring for young children. This fall, I have professionally seen volumes of respiratory illnesses in kids higher than I remember possibly ever in practice. Personally, I've had a near full-time job caring for my own kids who have not gone a single week without fever, cough, or boogers from somewhere on their face since September. Each night I spend in my kids' beds, half comforting them and half sneakily assessing their breathing in the night. I think not just about how I'm going to manage my following workday, but about all of the parents out there trying to juggle all of these same things. It's exhausting. It can be overwhelming. And it's why I'm always happy to talk to any parents with any concerns about their children. I know how hard it is. There's a lot of discussion about how COVID and our protective measures have robbed our young children of their chance to develop resistance to these bugs. Many of us were grateful not to have to take on the burden of these additional viruses while navigating all of the COVID uncertainty in the past couple years. That was stressful enough. We did get a bit unused to dealing with these viruses in our kids, so maybe this feels even harder now. I also think the media attention to COVID and now flu and RSV has instilled a fear in parents that we haven't had before with these respiratory illnesses. I find a lot of parents I speak to are essentially waiting for things to get worse, even when their kids have mild symptoms. It's become harder to separate what's going on from what we're hearing about in the news. This again is why I am always happy to talk to parents about their sick kids. We are scared and it's not our fault. It is more important than ever to have reliable medical information to guide us as parents. As doctors, it's more important than ever to listen with empathy to our worried parents. We will all get through this together. Thanks.
You would think after 3 years, I'd remember to unmute. So our next panelist is Dr. Claire Murphy. Dr. Murphy is a family physician who practices in the North Toronto community and has been doing so for the past 20 years. Her patients cross the entire lifespan from newborns to the elderly. She is an assistant professor at the Department of Family and Community Medicine at the University of Toronto and is an active teacher, having trained many learners at both Women's College Hospital downtown and Sunnybrook Health Science Center in our local community. She has been very involved in the COVID-19 pandemic response through her work at COVID assessment clinics, as well as being an active team member in our mobile immunization efforts, all the while continuing to practice in her clinic in the local area. So, Dr. Murphy, over to you.
Thank you, Karen. And thank you to everybody who's joining us tonight. Next slide, please. So as Karen mentioned, she and I together have been practicing in the North Toronto community for over 20 years. And what I thought I would do tonight is invite you into our office and give you an example of what I might share with the patient and their parents about how to navigate the triple threat this winter. Next slide, please. A typical day might include parents bringing in their 5-year-old to catch up on their school-based vaccines that they fell behind in during the pandemic. And I'm using this example for a reason. Please review your child's immunization records. Check in with your primary care provider or Toronto Public Health. Many children across the city are behind in their school-based vaccines and we would like to get them caught up. So while parents have brought in a 5-year-old, they're expressing concerns about what they're hearing in the news. The triple threat of RSV, influenza, COVID overwhelming the hospitals, leading to long emergency room waits and a shortage of pediatric ICU beds. They're worried about a shortage they've heard of children's fever and pain medication, such as acetaminophen and ibuprofen. And they're also concerned because they've heard about a shortage of an antibiotic called amoxicillin that they understand is being used for a variety of pediatric infections. Next slide, please. So I tell them to start with prevention. It's boring, but it's so true. Wash your hands well and often. And if you can't wash your hands, use hand sanitizer. Wear a paper mask in crowded indoor public settings. Cover your mouth when you sneeze or cough by putting it into your sleeve, not your hands. And don't go to school or work for that matter when you're in the first few days of an illness. Next slide, please. And get vaccinated against the influenza and COVID-19. They are safe and they are effective for children aged 6 months and above. And I included this slide this evening because this is a team from both Sunnybrook and the North Toronto, Ontario Health Team. It was a photo of us doing COVID-19 vaccines last year during the pandemic. Next slide, please. So what do you do when your child gets sick? The important message I want to relay to you this evening is most viruses can be managed at home. Start with getting a good thermometer. We prefer digital thermometers. They can be used in the armpit, in the mouth, in the ear, in the rectum. Many parents are opting for a more convenient, understandably, forehead strip, but those readings can be very inaccurate. And know how to take a proper temperature and where. In children under age 2, we prefer the armpit or the rectum. Over age 2, you can also do the mouth or the ear. And know what a fever is because it's different depending on where you've taken it. So over 38 degrees Celsius is a fever in the ear and the rectum, but over 37.5 degrees Celsius is considered a fever in the mouth and the armpit. And lastly, treat your child, not the number you see on the thermometer. If your child has a low-grade fever, but they're energetic and they're drinking, you don't necessarily need to treat that. But if they have a higher fever and they're seemingly lethargic, not drinking, then it is important to treat them because a high fever can really obscure your ability to decide if you need to be seeking care or not. Often, if you bring down that fever in a child, they perk up, they start drinking, and you know you're going to be okay. If you're able to dose the medication for the fever based on weight as opposed to age, I know that's not always possible, but if you are able to, then that's preferred. Finally, don't worry if your child's not eating. When adults are sick, they don't eat either, but it is important that your child drinks fluids. You can opt for water or soup or popsicles, diluted juice, or you may have also heard about oral rehydration solution called Pedialyte. Those are all acceptable. In younger infants, we prefer breast milk or formula. But it really is important to stay hydrated. They lose a little weight, they will gain it back. The other common question I get from parents is, it's really hard with diapers and pull-ups. They're so absorbent these days to monitor the urine output because that's a sign of how well your child is hydrated. So we often will recommend putting a small little bit of toilet paper in their diaper area, and that will allow you to identify if they've had a pee or not. Now, I think we'll address medications a little bit more later by another panelist, but I will say that we recommend you avoid over-the-counter cough medication. It's in general, but especially in children who are 6 years of age and under. You can give them warm fluids, and if they're over a year, you can give them some honey as well. Works very well as a cough suppressant. It's also helpful to have a cool mist humidifier in their room. It keeps things moist and well hydrated. So what about the individual symptoms that children have? Well, nasal congestion, we often recommend using saline sprays and nasal aspirators. For pink eye, lots of pink eye is also viral, especially if it's associated with cold-like symptoms. So you can just use natural teardrops, which can be very soothing, and warm compresses. If your child's pink eye doesn't have any related cold-like symptoms and is really accumulating pussy discharge regularly throughout the day, not just when they've woken up, that might indicate a bacterial infection. But most we're seeing these days are viral. What about ear pain and ear infections? Well, many of those can be viral as well, not all, but many. And so we recommend treating your child's pain for 1 or 2 days. And as long as they can be kept comfortable, it's worthwhile doing this because often the pain will go away. And finally, not all sore throats are strep throat. Often viruses start with a sore throat on the first day, and then 1 or 2 days later, the runny nose and the cough comes. If a sore throat has a runny nose and cough, it's viral, it's not strep. Next slide, please. And what about COVID-19? Please try to do a proper rapid antigen test. They're available at grocery stores and pharmacies. The way we would like you to do them with this new Omicron variant is to take the swab and put it in between their, if possible, it's a challenge, I know, with young children, but if possible, to put the swab in between their lower teeth and their gums and turn it 3 times both sides. Try to swab the back of their throat, and if that's too difficult, the back of their tongue, and then to gently put it up 1 centimeter into each nostril. That provides a very good sampling. And if you're doing that every couple of days for the first 4 days of an illness, it will, and it continues to be negative, there's a large likelihood this is not COVID. Next slide, please. But if it tests positive, all the information you need is on a wonderful website that was created by the University of Toronto Department of Family and Community Medicine and the Ontario College of Family Physicians called Confused About COVID. It will offer all the guidance you need if COVID comes to your house. Next slide, please. So when should you call your primary care provider, your family doctor, your pediatrician, or your nurse practitioner? We want to hear about a fever that lasts more than 3 days, not on the 3rd day, but on the 4th day, if your child continues to have a fever. Now, many of the viruses this year are causing prolonged viruses and fevers more than we're used to. But we would still like you to reach out to your primary care provider's office on with a fever that lasts longer than 3 days and just check in with them. We also want to know about a fever that seemingly went away, but 1 or 2 days later came back, because that might signify a bacterial infection. Regardless of day 1, 2, or 3, if you have a child who seems unusually irritable or lethargic despite treating their pain or their fever, we want to hear about that. And finally, if you are struggling, to get them to drink fluids and stay hydrated. Now, I'm not sure if you can see tonight, I purposely wore my stethoscope for a reason. Now, I'm going to take it off because when your child appears short of breath, we want to see your child in the office. How do you assess shortness of breath? Well, I often don't even use my stethoscope. I look at a child, and you can do this as well. If your child is flaring their nostrils, if they seem to be tugging in above the breastbone, or the skin around their ribs is sucking in, appearing like an accordion, that means that they're working hard to breathe and the infection is likely gone into their chest. If you're starting to notice that, please reach out to your primary care provider. Ear pain that lasts longer than 2 days despite treating it, I've already mentioned that. And certainly if you see discharge coming from the ear, or your child has a particular history of recurrent ear infections. And persistent sore throat that might not be associated with cough or runny nose, or is so severe you're having a hard time getting your child to drink fluid. One last little bit of advice. After tonight, I really encourage you to find out how to access your primary care provider after hours. Many family doctors are offering multiple after-hour clinics, and this will be posted on their phones, their website. They often have an affiliation with the telephone health advisory service nurse. And if they don't, then the Ontario government has Health Connect Ontario, and you can call 811 and speak to a nurse to get advice. And you will hear a lot about multiple COVID-19 cough and flu clinics that are being run across the city this winter to help see children with these symptoms. Sick Kids and has a virtual care clinic that if you're uncertain what to do, having a hard time reaching your primary care provider, is a good resource, as is the Toronto Virtual Emergency Department, which is a partnership with Sunnybrook, Unity Health, and University Health Network. All of these resources will be provided to you at the end of the webinar. It's always good to know where to look, and best to do so when your child's not sick, so that you know where to go to when you're in distress. Next slide, please. So when do you go to emerge? Any fever in a child or infant who is younger than 3 months of age, that is a definite go to the emergency room. Any child who is dehydrated, you haven't seen any urine output from them in 8 to 12 hours, they don't seem to be crying any tears, that is an emergency. And if you see severe shortness of breath, all those symptoms that I mentioned before, and particularly if they're unable to feed or they can't sleep because they're short of breath, that is a reason to go to emerge. And finally, extreme lethargy. A child who is just moaning and groaning, you've treated their pain, you've treated their fever, and they can't even muster up a cry, that's a reason to be going to emerge. Next slide, please. So I hope this evening I've provided you with triple the knowledge so you can have triple the strength to get through this triple threat this winter. I know you've already made the best choice you could have by joining us in the webinar tonight and learning about how to manage things. And I thank you for that. And then that's a wrap.
Thank you, Dr. Murphy. So now we're on to our last of the three speakers before our question and answer. I would like to take this moment to remind people that please do put your questions in the Q&A box so that we can answer them at the end of our last speaker. So we're very fortunate to have with us tonight Joe Arbus, who is a pediatric clinical pharmacist who works on the neonatal intensive care unit at Sunnybrook. Joe has previously worked at both Great Ormond Street Children's Hospital in London as well as sick kids, and currently coordinates the RSV prevention program at Sunnybrook. She's also mom to 2 elementary school age daughters, so is acutely aware of all the current circulating viruses and the strains on parents desperately hunting for acetaminophen, ibuprofen liquid, and access to solid medical information. So without further ado, we're going to go on to our next panelist.
Thank you, Karen, and hi, everybody. I'm going to talk to you about over-the-counter medications that are sold in pharmacies and other stores without a doctor's prescription. They're generally used for common cold symptoms like runny noses, congestion, sore throat, headaches, and coughs. But just because they're easy to get doesn't mean that they always work or even that they're right for your child. Often the best treatment for colds and viruses are still plenty of rest and lots of liquids. One of the important things to know is under the age of 6, you can't use any over-the-counter cough and cold medications like Tylenol, cold and cough. The only thing you can give to your children 6 and under is ibuprofen, such as brand names Advil or Tempra, or acetaminophen, which is Tylenol. Under 6 months old, you can't give these. So between 6 months and 6 years old, you can use these dosed appropriately for your child to help with fevers. We can talk later about the problem in getting hold of these for your children at the moment. When our kids are sick, we want to do everything we can to help make them feel better. But it's really important to realize that some of these medications and the ones to help with coughs, there's actually no proof that they really work. And in fact, some of the side effects can make your child feel worse. It can be really stressful when a cough keeps your child awake at night, but coughing can actually be helpful. It can be a sign that the body is getting rid of mucus that's irritating their airways. And syrups that stop this normal response can actually be harmful. Some over-the-counter cough medication contains codeine. It's really important that nothing containing codeine is given to children aged 12 or under. So always check the label and then speak to your healthcare provider, whether it's a doctor, a nurse practitioner, the pharmacist, or the nurse. Decongestants are another kind of medication that people often take over the counter, and they're actually from the same family of medication as adrenaline and can be a stimulant. So this can actually mean that they can cause your child to have insomnia and not be able to sleep. So we often don't recommend decongestants in children. One of the things we do recommend is nasal drops or nose sprays if they are congested. Just some saline drops can help soften the mucus. The one thing we do recommend if your child has a fever is acetaminophen or ibuprofen. They come in drops, liquids for toddlers, and chewable tablets for older children. You mustn't give ibuprofen to babies under 6 months old without talking to your doctor first. And then the other important thing to note is many of the cough and cold, such as Tylenol cough and cold, also contain acetaminophen. So you need to make sure you're not getting acetaminophen from the cough and cold medication, as well as giving your child regular Tylenol as well. So again, make sure you speak to the pharmacist, to the doctor, to make sure you're not double dosing on any of these things. And then going on to natural health products. Natural doesn't always mean it's safe. Just because it's safe for adults doesn't mean it's safe for children. So again, before going down those routes, speak to the pharmacist, speak to the healthcare provider. We can hopefully help you and make sure that what you're doing is best for you and your child. And that's me done. Thank you, everybody. And if you have any questions, please ask away.
Thank you. That was very helpful. So we're on to our Q&A session. So please do put more questions in the Q&A, and we will put resources in the chat because we'd like to provide you with the resources that we talked about over the course of this evening's presentation. And if any other resources come up, from our questions, we'll also add those too as well. I want to echo Dr. Murphy's comments of the right time to figure out how to access your primary care provider after hours is not after hours. You want to take a look in advance, check to see what their hours are, where they're running clinics, and so that you're prepared and ready if and when that happens. Unfortunately, with the current triple threat, you are likely going to experience respiratory signs and symptoms. So just to have it ready when you need it. So I'm going to pass over to Nazia as well as Kitty to facilitate our questions.
Thanks, Karen, and thank you to our panelists. We'll start with a question from Marie. She has a 12-year-old and a 14-year-old, and she's wondering what kind of trends are you seeing in this age group with the triple threat of viruses?
I can jump in and answer that one, Kitty. I'm actually looking at a graph and a chart as of November, ending the week of November 26th. And for 12 and 14-year-olds, I would say most of the specimens that have come through that are positive are influenza. So another reason to go get your flu shot.
I like that plug. Nadia, you want to go to the next question?
Yes, I sure can. So the next question is, how accurate is the COVID antigen test? And is there any difference in using tests from previous years versus tests now?
Ali or Claire, either one of you want to speak to this one?
My understanding is that the tests are less sensitive, so they're less likely to pick up results in immunized people, which means that the recommendation now is to do repeat tests to capture. So if you do have a positive result, that's helpful in that it is almost always a true positive COVID test, especially if the context is important too. So if somebody has known contacts with COVID and they have a positive test, that is, more clearly a true positive COVID test. If you have a negative test, the thinking is to repeat test every 1 to 2 days, at least 3 tests to know that a negative is very likely negative.
Thanks,
Thank
Ali.
you, Ali.
Okay, our next question is from a new comer family to Canada. They have a 2.5-year-old who has been sick twice within 30 days. Even though they have done, the vaccine that is required before coming to Canada, their daughter is still getting sick, and they currently don't have a family doctor. And when they go into walk-ins, the medication is not available when they want to fill them. She's wondering they're wondering what they can do for their 2.5-year-old.
I think I'll take that question. It is a challenging question. We do know that there is a gap at the moment in primary care providers, and our local area is not immune to that. So over the pandemic, there's been a number of changes. There's been retirements. We're seeing less people going into what we talk about comprehensive family medicine. So it is proving to be a challenge. So we're all aware of that gap. So that is partly where the cough and cold clinics have come to be, to provide that area where you can access readily for those that are unattached to a pediatrician, nurse practitioner, family doctor, a need for care. And in the resource part of tonight, we will provide those links. For people who are in this kind of local area, over in Thorncliffe Park, there is a kids cough and cold in the plaza over in that area. Michael Guerin also has a kids urgent care within the emergency department. Women's College downtown has one, North York, as well as Humber. So there are resources that are available. Finding a family physician, a nurse practitioner, or a pediatrician can be difficult, but there are ways to look at getting connected. And Healthcare Connect is another resource that Kitty Pang just put in the chat. So we hear you. It is a really hard problem, and it's not going to be easily solved, but these are some of the resources that are available in the meantime.
And if I can just add to that, Karen, everything that I was thinking, preferably the cold, cough, and flu clinics than a walk-in clinic as well, because some of these clinics will also provide a follow-up phone call the next day and some guidance for you, whereas that may not be as easily accessible with a walk-in clinic. So they're great to know about, and they are all staffed by physicians and nurses and nurse practitioners who are very comfortable managing all these viruses.
Okay, great. So we're going to move on to the next question. So this person asks, do you recommend limiting the number of people at holiday gatherings or avoiding them altogether, particularly for families with children too young for COVID and flu vaccines, such as being less than 6 months?
I think Joe or Ali could take this one.
So hard. I have a limited, I think so many people are so tired of missing, you know, family gatherings and events that at this point, it's a real challenge for people. I think probably there may be ways to do it safely and comfortably. You know, so if people are comfortable wearing masks, or if you can trust your family members who, you know, if they're sick, you know, to not attend or wear masks, that may help. That's such a tough one. Joe?
For me personally, one of my children has special needs, so I am very cognizant of these kind of risks. So I generally do ask our wider family to take a rapid test if we are going to get together. That's my comfort level. Everybody else, I think, has different comfort levels. But for me, and again, rapid antigen tests aren't 100%, but for us, that's where I feel comfortable.
Well, Joe, I think you bring up a good point, is that I think really we can't answer this question for you. This is an individual decision that's balancing the risk profile of the people in your family, and who might be attending, grandparents who can get vaccinated, who cannot get vaccinated, who have special needs, who are immunocompromised. And balance that out with mental health and how difficult it's been, such as Ali mentioned. So I don't think there's a right or wrong, and nor should you feel that you're making a right or wrong decision. The best thing you can do is make a decision that feels comfortable, that's a balance of the risks and the benefits. I know our family, some of our close friends, we've had many holidays where we've had to either cancel, or the larger group has turned into a teeny group because someone has gotten sick last minute, and they correctly have declined to come. So have a contingency plan, be flexible, know it can all change, be happy to get together in outside, inside, with masks on, without. It is a kind of advice we can't give you because certain things are important to certain people, but those are the things to consider, and I think we would all consider.
Well put.
Thank you. I think the next question is also related to this. The question is about specifically a water park, but I think a lot of families are going away this holiday season. They're wondering, even if they have their flu and COVID vaccine, is it safe to go away? Is it safe to visit, a large public space?
I think the answers are quite similar to what Ali and Claire have already and Joe have shared. So we do know that there are things that we can do: hand washing, wearing masks. If people are flying, if people are going traveling in that way where you've got more people in a confined space. Mitigating the risks with what strategies that we know have been helpful, and deciding yourselves what risk you are prepared to undertake. And I think that's the best we can do at this point, 3 years in.
A lot of these are the same children that are being exposed at school to other children and things that, anyway. So it's just I don't know how we've arrived at this place where every decision feels like there's no right answer. It's like bad for this reason or bad for these other reasons, and there's no win. It's so challenging.
And while we're so thrilled you've had your flu and your COVID vaccines, they're not 100%, and you could still get RSV. So it's helpful. Absolutely. I think, yes, good point. Often, the school system, kids going to school are the same kids who are going to the water.
Okay, so the next question is, someone is asking, I have a children's DPH, cold and cough. It has a dosage for babies under 6 months. In this case, should I still not give it to my baby?
That is definitely for Joe.
That is me. I'm sorry. Can you repeat the question for me? I'm sorry.
Yeah, I can repeat it. This person asks, I have a children's DPH, cold and cough. It has a dosage for babies under 6 months. In this case, should I still not give it to my baby?
I would ask this person, who are they giving it to? The guidelines they've given are really for medication over the counter, for you self-medicating your child. If this was prescribed for your child by a physician or nurse practitioner, that is very different. But if it is just something which is over the counter, absolutely not.
Okay, the next question is the $1 million question. How long is this triple threat period expected to last? Right until spring?
Most likely. While we're all inside, while the cold weather keeps us wanting to be in our warm houses more than out in the winter time, then chances are, it'll have ebbs and flows, I imagine, because people will develop some immunity. Obviously, if you get COVID, you have a good chance, at least 3 months, that you probably won't get it again, but it will come and go during the winter months.
Okay, so the next question, this person is asking, my daughter has fluid in her ears and has had several ear infections since Thanksgiving, as the fluid doesn't have a chance to drain before she gets the next virus. It's usually a cold cough, not always a fever. If she's fever-free, should I still be getting her ears looked at if I can tell she's been pulling at them for a few days? My daughter is 18 months.
Allie, did you want to answer?
I think that sounds reasonable. If it's been a couple of days, as we've said, like, the interesting piece with ear infections is my understanding is that when I was a kid, we got antibiotics at the first suggestion of an ear infection, and they got better. And my understanding now is that we know that the overwhelming majority, maybe 90-something% of them, actually do get better on their own anyway. Generally, I think that guidance is for kids over 2 years anyway. So under 2 years, they probably should be looked at earlier in the first day or two of pain, and then after 2 days over 2. Because if it would have cleared itself, it would have done it by then.
And maybe Ali, you could answer this question too, is all the ear pain infections coming on. How concerning is a regular mild ear pain with no other viral symptom in a child under 6? The child has similarly recovered from a previous bacterial ear infection antibiotic course.
So that suggests that there's probably something still going on behind that eardrum, like some fluid accumulating there. Personally, I would want to see it. So I think if it continues, a non-urgent appointment with a primary care provider would be best.
So the next question is, our daughter is 4 months old and her mother and father were vaccinated for COVID up until the booster shot, which is the 3rd one, prior to pregnancy. Which COVID vaccine should we start her with when she turns 6 months?
I can answer that one. So first of all, great that you're planning to vaccinate her. It's definitely the right decision. At the moment, we are still offering the Moderna vaccine, but you may have heard in the news that a new Pfizer vaccine has been approved in Canada for this age group. As far as I know, it's not available yet. So there is a difference between Canada approving a vaccine and it being available. At the moment, my understanding, unless anyone else wants to pipe in, is that it's still the Moderna vaccine that's being offered for this age group.
Joe?
I heard the same. I heard Pfizer is coming, but at this point isn't available. The other thing I did want to add, though, was if you are breastfeeding, as you've been vaccinated, some of that will pass on to your baby while you're waiting for the magic 6-month mark. So I'm not sure if you've had your bivalent booster yourself, but we would definitely recommend keeping up with those vaccinations while breastfeeding.
The next question is about when would a child be safe to return to school? If they're wondering if they'll be too contagious, if their fever has subsided and their energy and appetite has returned, but their cough remains. Will they be safe to return to school?
Yes, they'll be safe to return to school. The current guidelines are, as long as there is no fever for 24 hours, no vomiting and diarrhea for 48 hours, and your child is clearly improving, they can return to school. Ideally, avoid any high-risk settings, such as hospitals or visiting grandparents who might be in long-term care. And if you can get them to wear a mask in public indoor settings, that would be ideal, but not always possible. But if they're feeling better, 24 hours of fever is gone, no vomiting, diarrhea for 48 hours, the cough often remains. You'll talk to, I'm sure Ali will verify, kids cough all winter, basically. So they're absolutely fine to go back to school.
I had my finger on the unmute button to say just that.
And the same is
Cough.
true for parents
Weeks.
for return to work. So just highlighting that as well, if we can. Next question.
So the next question is, my child, a 3-year-old, got RSV and COVID, which triggered the bronchiolitis recently. Unfortunately, he was in Sick Kids Hospital for 2 weeks because he got lung leakage and subcutaneous emphysema. If he got the same virus again, or COVID-19, does the stats show a higher probability to get the bronchiolitis or subcutaneous emphysema again?
That's a tough question. Karen, good, you're jumping in.
I was going to say, excellent question, and it is a tough question. So I think that would be a question that's given how specific it is, to have a conversation with the person who's caring for your child. So it's difficult to know just from the history what happened over the course and what might happen in the future. Ideally, that wouldn't be the case, but I think it warrants a conversation, and that must have been incredibly difficult for you at this time to be in hospital for 2 weeks. So.
Our next question is, what is the recommended wait time between flu and COVID vaccine for children under 5?
Can answer that one. So for children under 5, we are waiting 2 weeks between flu vaccine and COVID vaccine. For everyone over 5, they can get it on the same day, the next day. There's no wait period, but under 5, it's currently 2 weeks between those 2 shots.
And just to add on to that, our understanding is it's not that we anticipate there is any interaction between the vaccines that will be detrimental at all. I don't know if you all recall when we first introduced the COVID vaccines, there was a 2-week wait between the COVID vaccine and other ones, even in adults. It's really about monitoring side effects. We want to, public health monitors the side effects from all these vaccines. And so they want to know if there is a side effect, what vaccine to attribute it to. It's not at all, we actually expect that they can be given together very, very safely and anticipate that down the road. And in fact, you can have that conversation with your primary care provider. If a situation is such that you are unable to wait to that 2 weeks and you've had a discussion, that might be a reason to go ahead. But if their time allows, we are hoping just to keep an eye on side effects from vaccines, and the 2-week intervals recommended.
I'll also just give a comment speak to the challenge of that. Right now, when kids are sick every 5 minutes, it's hard to get 1 vaccine into them. It would be amazing to be able to get 2 on the same day. And I recently went through this with my youngest, where having to wait those 2 weeks, it was so challenging. Every time we planned and scheduled to get this vaccine done, he had another fever and another illness, and we had to wait. And it's work to get these done, but it's so important.
Okay, so the next question is, our family is having a hard time debating whether or not to send our 17-month-old baby to daycare in January, given the current situation. Any tips on how we could better prepare our little one?
Nope. Just kidding. It's such a challenge. All of the measures, though, that Claire spoke to, the daycares are really trying hard to also enforce these. So, the hand washing. So my youngest child is at daycare. And he is so good. He is like the model hand washer in our household. They really do try to do the best that they can to prevent these. Unfortunately, it's just with such young children and so many viruses, it's likely that they are going to get sick with exposure. And most of these illnesses, we haven't spoke to this, but most of them are quite mild. I don't know if that's helpful.
So our hour appears to be slipping by very quickly, and we just have a few more moments. So I think we'll only be able to get to a couple more questions, but I do want to draw your attention to the resources that are in the chat. So time for a couple more, maybe one more.
I think Nazia, you could go. The next question was already answered in the previous.
Sure. So the next question is, what's the recommended priority for teens? COVID vaccine number 4 or flu shot? Will they get both over the next few weeks, but which one should be recommended first?
And can I jump in here? In children of that age, they can actually have them both together. I actually have 12-year-old twins myself and took them to get theirs together, which wasn't much fun for them or for me needing to drag them there. But again, in a child of that age, you luckily don't need to prioritize and can hopefully get them both.
I think we all agree on that one. And you don't want to have to do 2 trips. And if you're successful enough to get your teens to 1, both arms.
Yes, it took a lot of bribery on our end.
Both arms.
Sounds good. So we are at time, but I really wanted to thank everyone who took the time out of their evening to come ask questions and be available this evening. Thank you so much. And I'd like to thank the panelists for giving their time and being here tonight. So these are just some of the resources that we've put in the chat. Please do download these resources, and hopefully this will be of use for you going forward.
Thanks, everyone. Thank you, Karen, for organizing.
Thanks, Karen.
Thank you, everyone.
Take care and good night.